I'm sure you see a lot of female cancer patients, especially we're talking about breast. How do you go about your approach?
Part of my job is also to explain the science behind things, the studies, like what have things shown, not just the overall perception of what a lot of people think who don't fully understand medicine or the cancer that they have. For example, breast cancer, first thing patients think, okay, I need to remove the entire breast.
What I've been hearing is just take it all, take them both, and you give them options based on their lifestyle.
Most of the time, it's not the case. We can save the breast, we can do what's called a lumpectomy. Saving the breast has about the same or sometimes even better overall outcomes than taking the entire breast. I just never want somebody else to feel like that.
Hello, hello, hello. This is Kenny Perkins, aka your cancer guy, and today I'm bringing you another phenomenal guest. I'm never going to get tired saying that because I believe every single guest that I have is phenomenal. And this one, we're traveling down to Florida for this one, Plantation, Florida. And this is a breast surgeon who just didn't come about her career in your traditional way where the families just groomed you. No, this person came from Rhode Island. Her parents are originally from Italy. They migrated here. She's from Rhode Island. She didn't have a roadmap where people can teach you or guide you in a way that you can go to be a surgeon, right? She didn't have that. So she navigated her way through this on her own, which is very commendable. And it's just to find a career sometimes without the guidance that you need can be difficult. But this next guest, she's a surgeon and she's done her research. She's involved in research. She's done her first generation in college. I love that about her. She did some of the training in Philly, Moffitt. She went to Moffitt University, did some more fellowship there, and just come a long way. And what I love about her is not only is she a woman surgeon, and I say that because it's not easy. And if most surgeons are men, and that can be a male dominated role. And yet she beat the odds and came through, and she's benefiting all of her patients there in Florida. And it's amazing. I am honored to be able to have her on our show. And so please give me a round of applause as we bring in Nocera Zachariah. Dr. Nocera Zachariah, welcome.
Hi, thank you so much for having me.
Yeah, for sure. Thank you so much for joining us here at All Talk Oncology. It's a privilege, as I said,
Absolutely.
and I want to get into it because I'm sure you see a lot of female patients, cancer patients, especially we're talking about breast, right? How do you go about your approach? Give us a little bit of background on how you ended up and landed in Florida. How about that?
Well, I landed in Florida pretty much for most of the reasons why people come here, the weather. I was born and raised in Rhode Island. I did all my training up in the Northeast, medical school in New York, training in Philadelphia. Part of my life dream was always to move to Florida and to enjoy the perks of the weather and everything here. I raised my family here, so I've always tried to figure out what my goal was and reach it, and this was one of them.
Yeah, you've definitely done that. Florida is a beautiful state. And here you are, you're a surgeon there with a beautiful family. I think you have, what is it? Did you tell me two kids?
Yeah, 2 and a 4-year-old.
Yeah, it's
Mhm.
amazing. So you're not only juggling your patients, you also have a family that you need to tend to, right?
Oh yeah, they keep me on my toes.
I love it. I love it. So here we are. You made it from Rhode Island, and God, I can only imagine just the temperature there in the winter
Brutal.
to sunny Florida. So tell me a little bit about your practice, what you're doing out there.
So, like you said, I see breast cancer patients. So, I am a surgical oncologist. Part of my job is to take the cancer out. A lot of times, when people, after they reach their initial or find out their initial diagnosis from like a primary care or OBGYN doctor, they'll see me first And my job is to help dictate where they need to go for their next treatment or how their treatment plan is going to play out. So sometimes we have to do surgery first, sometimes they need chemotherapy first, certain things like that. Part of my job is to first educate the patient. What do you have? What does all of the pathology mean? What does all the imaging mean? What does this mean for you in terms of your treatment? I really like to take the time, sit down with my patients, fully educate them. I think that's always a big piece that's missing when you receive a diagnosis is what does everything mean? People often jump straight into, okay, you need to do surgery, you need to do chemo, but people don't understand why. What does everything mean? I think part of my goal, especially coming from background that's not medical, is to help people who are non-medical fully understand what exactly is going on with them and their body.
I love that. I love that because a lot of times they have no idea. And so for you to sit down and be able to explain to them, and you and I, we spoke about options, and patients, sometimes they don't know their options. They just know, hey, you know what? I have cancer. I don't know. What I've been hearing is just take it all, take them both, and you give them options based on their lifestyle. Can you explain that?
Yeah, so, that is very common for me to have a patient come in and sit down and say, okay, just take everything, take it all off. I don't care. But part of my job is to backtrack a little bit, calm them down a little bit, and figure out what is appropriate and what is too much, too little. So, for example, breast cancer, first thing patients think, okay, I need to remove the entire breast. But most of the time, it's not the case. We can save the breast, we can do what's called a lumpectomy, just take the cancer out. And then many times they will need radiation. And then what does all of that mean in terms of their overall survival, their risk of recurrence? And despite what many people think, doing a lumpectomy plus radiation, saving the breast, has about the same or sometimes even better overall outcomes than taking the entire breast. I Part of my job is also to explain the science behind things, the studies, like what have things shown, not just the overall perception of what a lot of people think who don't fully understand medicine or the cancer that they have.
Yeah. I want to make sure people know where they can find you. If you're in Florida, you can find Dr. Zachariah there at Miami Cancer Institute. She's running things down there and she's putting protocols together. And I want to make sure you know where to find this physician or
Mhm.
this surgeon. And I want to make sure I say that correctly. Where you can find this surgeon, she's going to take good care of you. In the introduction, I talked about this being a male dominated field. But you know what? There's some benefits of being a female, right? Tell me a little bit about how it's like to be a surgeon and looking at it from your perspective when it comes to patients.
Yeah, so, being when I was in training, pretty much every attending or boss, if you can look at it like that, everybody was men. It took a few years into training for me to actually see a female surgeon who was our attending. So I never really had a true female to bond with to be a mentor in the surgery world. Being a woman in a man's field, although it is changing as we go progress through time, back then it was just very male dominated, a lot of male energy. And I think being a female, and I guess somewhat sensitive person, very empathetic, it was difficult for me to be on that level of just get it done and get it over with. I looked at my patients as people who have families, people who have jobs, people who have things they need to do, not just their disease. I think that kind of, I don't know if it made me think a lot more, think about my patients, and sometimes that's not always viewed as a strength in terms of surgery. It's all about speed and getting things done and pushing things through. get from step point A to point B. So I think that's what also guided me towards doing breast surgery. It's more of a sit down, talk, empathetic type of field. It matched my personality much more. It wasn't just like one and done. I take out your gallbladder and you're out the door. I care for my patients through their whole process. I see them for many years afterwards. So it's definitely something that, as I'm very passionate about. I love my job, and even though it was difficult to get here, it was definitely worth the whole process. Yeah,
Empathy goes a long way. And sometimes the people that want to get it done, it's very difficult for them to express their feelings and emotions. And sometimes it's a hindrance for them. And so I don't tend to judge those individuals
yeah,
just as they shouldn't judge those that want to take the extra care and empathize with their patients because that is your gift. Here's your
yeah,
God-given gift, and I want to make sure I highlight that about you.
absolutely.
Yeah, I want to make sure I highlight that about you because sitting down and not feeling rushed and feeling like you're not just another number is very important when you're about to have surgery. You're about to have something removed from your body. You're in a very vulnerable situation. I love that you are able to connect. You take that extra time and shout out to all the other surgeons who do the same thing. I want to recognize that and say thank you for that.
Yeah, it's really important. And I think in my life, I've experienced times where family members were sick, and I wasn't quite as advanced in my medical training, so I didn't understand a lot of things. So I always think back as to like how I felt during that situation. I just sometimes things weren't fully explained. Maybe we regret decisions that we made because we didn't truly understand the situation, and I just never want somebody else to feel like that.
Yeah, that's what makes you phenomenal. That's what does it. And be able to give them options and options that a woman can understand. You're talking to another woman who may be who going through something that sometimes there's a disconnect. I just know that I do need to get it out. And you're saying we can get it out, but at the same time, we can do X, Y, and Z. We love that. One of the things I
Mhm.
want to talk to you about is here you are, you're like the head. You've been appointed, anointed as the head, and here you are. Tell me a little bit about some of the things that you've unfolded in your clinic and where your surgical institution and where you're at.
So basically where I am, so Miami Cancer Institute is my main like parent institution. I am part of so basically a Baptist Health, which is our health system. They wanted to have a place in Broward County and Plantation for patients to make it more accessible for them to be able to get cancer care. I am the sole surgeon there. I started there right after fellowship. It was basically a fresh, new location. Nobody really understood what a surgeon needed there, what having a surgeon in clinic entails. So it was pretty much up to me to figure out what could I do to make it a good place to have breast cancer surgery care. What equipment did I need? How would I plan my clinic? What would be the most efficient way to do things? What can I offer my patients that maybe other places may not in the area? It was up to me to figure out all those things. I didn't have too many people guiding me, telling me exactly what I need to do, which is a good thing in many cases. I was able to create my own type of clinic, how I wanted to do it. And so far it's worked well. I feel like I've been able to reach a lot of patients who may not have been able to see a breast surgeon otherwise, and they're somewhat convenient to their home. It's been a really nice progression to where we are now.
Yes. And I don't want to let everyone know too that's listening in. If you think there's a restriction, because guess what? There's a language barrier. Dr. Zachariah, she speaks fluent Spanish, huh? Not only does she speak English, but she's fluent in Spanish and she's Italian. So we love that part about it. Whatever you need, she's going to make sure that you guys are taken care of. I love that. Nocera. Do you go by
Mhm.
Nocera with your patients or do you go Dr. Zachariah? What do you normally tell them?
Usually no Sarah, but I'll take either one.
See, that's so humble. She's just call me Nocera. Here she is, a surgeon, put in all her work, and that it's that piece. It's that piece that I can see that your patients really appreciate you for. So tell us a little bit about some of the things that you're currently working on and maybe some screening or things that you guys do down there in Miami Cancer Institute.
So one of the things that we have implemented is a high risk screening clinic. So I partner with a couple of the medical oncologists in my building, in my clinic, and we see patients who are at high risk for breast cancer. So that technically means like 20% or higher lifetime risk. And we have specific calculators we'll use to figure that out. We also do genetic testing. So anybody who walks through the door, we offer you genetic testing. That will help us figure out if you have any genes that are mutated that increase your risk for not only breast cancer, but other types of cancers. That helps us make sure that you're getting the appropriate screening, appropriate treatment. Heaven forbid you might have develop a cancer, we can find it very early. So I think that's really important. And I also see a lot of benign things that a lot of people in the area don't see. Seeing certain diseases that are supposed to be rare, but actually I've been seeing pretty frequently, something called idiopathic granulomatous mastitis. I've a lot of people are pretty unsure how to treat it. A lot of times people are given systemic medications that don't necessarily treat the affected disease. They'll get antibiotics that aren't appropriate. I always am very happy when a patient's referred to me with what I suspect is this disease. I'll make sure it's appropriately diagnosed and treated appropriately by the certain protocols that I follow. And I've actually had a lot of patients who are very happy because a lot of people couldn't figure out what they had and they suffered for a long time and they've been able to recover from this disease. Yeah, so those are some of the main things. And then I do treat any type of cancer that walks through the door, any type of surgical issue, pretty much one-stop breast shop where I am.
Look at
So.
that. You know, that's what I really appreciate about you. So, talk to us a little bit about this, where people feel like they think that this is cancer, but it's really not. It's something different. Talk to us a little about for those who may not know, and I need to get a little bit more educated on it as well.
Yeah, so this disease actually, a lot of people first think it's infection. They might get what they think is recurrent abscesses, and it presents as like a very red, inflamed area that might feel like a mass. Sometimes it might actually look like an abscess with some fluid collection. Usually what happens is patients get multiple rounds of antibiotics. They might get these areas drained, so they'll have like multiple surgeries. And a lot of those things are not appropriate for this disease. Basically, it's so idiopathic granulomatous mastitis is like an autoimmune disease of the breast. It's antibodies against some breast tissue, and this breast tissue looks infected, but it's actually like a sterile area, sterile abscess. So whenever they get drained, whenever the pus comes out, it's really not pus, it nothing, there's no bacteria in it. These patients are always on lots of antibiotics, get lots of surgeries, but really what they need is to be given a anti-inflammatory medication. Usually what I give is Celebrex. That typically brings down a lot of the inflammation, brings down a lot of the pain, and then they will get injections into the lesion with a steroid called Kenalog. So that typically brings down a lot of the pain, a lot of the inflammation, and patients feel much better. They go for much longer periods of time without these flares. And a lot of people that have had multiple flares for long periods of time, once I start doing the protocol that I follow, they'll pretty much clear up and not have a flare for a very long time.
Love that.
Yeah.
Sparing them all kind of heartache, right? Going surgery after surgery, getting drained, what's going on? And then each time you go in, it's just more anxiety, like, oh my God, this thing is back. And for you to come in, excuse me, for you to come in and be able to put a protocol together, it's amazing for not only for the patient, but for the family and everyone to have peace of mind too.
Yeah, and they're always very nervous about it. It does sometimes look like cancer, and they think they're going to get cancer. And part of what I do is to reassure them that it's not, and it's completely benign. They're going to be okay. It's just something that is unfortunate and painful at times, but I can help them through it, and they'll be okay in the end.
For sure. I want to say this about you. And as you went through this process to get here, to be a surgeon, coming from Rhode Island and not necessarily having mentors along the way, as you mentioned, or seeing other surgeons like yourself, how is it that you give back or keep the doors open for those who may be going through this path or may need that mentorship that you were looking for?
Yeah, my door is always open to anybody who might approach me for, if they are interested in surgery, interested in breast surgery. I do, right now, I don't have students. I do encounter residents at one place I go to, but not as frequently as I would like. I do have scribes that work with me. So scribes, they will take notes for me during my clinic appointments. And most of the time, these scribes are college students interested in medical school. I talk a lot with them about what they want to do and see if they have any questions or if need any help with anything. If I do have a resident who is interested in breast surgery, I always support them and give them ideas about things that they could either do like a presentation on or write up. And so going through thinking back on things that I needed when I was going through training, things that I was looking for, I try to make that available to other people if they need it, if they have questions. I'm very open to any young person who's interested in what I do.
I love that. And especially because you know that feeling and you've walked that path. So what a great way to be able to be a mentor or keeping the door open to for anyone that's looking to advance in medicine. So I love that. I love that piece. Here's a question for you also. It can't be all about work all the time, right? Because there's a burnout, especially when you're dealing with cancer patients and things like that. How do you keep yourself balanced in this work field?
Yeah, obviously I have my kids who always take all my attention anytime I'm out of work. But for me, I think one of the most important things is staying physically active and staying healthy, eating healthy. I've always had a huge interest in weightlifting. Like we were talking earlier about going to the gym. I go to the gym before work. One of my bucket list things back in the day was to do bodybuilding competition. So I did that. But that has always, the physical activity, physical fitness is always something that has always really kept me grounded, kept me sane. When I don't exercise, I really get antsy and I feel it. I think that's really important for pretty much anybody for physical and mental health and well-being. It's definitely helped me through a lot of things.
Absolutely. And we have a lot of synergy there. I've done competitions for 10 years.
Mm,
Yeah.
oh, nice. Yeah.
Yeah. Men's
I
physique.
One day I gotta get back to it. That's my goal after
Right?
kids. Like, kids make it a little more difficult, but when they're a little older, that's my second bucket list item after kids bodybuilding competition.
We love it. We love it.
Yeah,
You keeping yourself active. And so that's definitely, as I know, it's definitely a well balanced way of getting out that stress,
yeah.
especially for what we're dealing with. Yeah. So thank you so much for sharing that and giving us a little bit more insight of Nocera. We appreciate you coming on here on All Talk Oncology. We appreciate the things you're doing for your patients. Before we let you go, is there anything that you would like to say to those that are listening in? Any tips you would love to give them?
I think the biggest thing, especially when you are encountering a cancer diagnosis, there's always hope. It's hard to stay positive, but the more you try to keep the hope alive, the better things are always going to be. The second you give in is the second that things can start going downhill. My job is to keep the hope alive. All of our other cancer physicians, we do our best to keep the hope alive. So I think that's the main thing anytime you have that diagnosis.
I love that. There are options. Never give up hope. A cancer is not the end all. It may
Mm,
be one chapter, but it's not the whole story. So that's
yes.
Dr. Nocera. We appreciate you so much for being here on All Talk Oncology, coming on here and expressing yourself and giving some light to those that may be in darkness. So thank you so much.
Thank you for having me.
Absolutely. And listen, if you're going through cancer, if your loved one, your mate is going through cancer, or you're a caregiver, just remember this: you're not alone in this. We're in this
Yes.
together. This is Kenny
Mhm.
Perkins, aka your cancer guy. And until again, I'm out.
So stay connected with us on All Talk Oncology Cancer Podcast. Make sure you subscribe to that, right? Wherever you listen to your podcast, whether that's Apple, Spotify, make sure you subscribe and continue to spread that word, right? Engage in this, because your engagement can help someone stay alive. And this is what we're talking about. So again, make sure you subscribe, hit that subscribe button. Again, this is Kenny Perkins, aka your cancer guy. Until again, I'm out.